Can DKA cause seizures? Have you ever wondered if diabetic ketoacidosis can lead to seizures? It's a serious topic, especially for those managing diabetes. Let's break it down to understand how this can happen. Diabetic ketoacidosis, often referred to as DKA, is a severe complication primarily seen in individuals with type 1 diabetes. However, it can also occur in type 2 diabetes under certain conditions. DKA arises when the body produces high levels of blood acids known as ketones. This usually happens when there is not enough insulin to allow glucose into cells for energy. The result is a dangerous buildup of ketones and a drop in blood pH, making the blood more acidic. Now, seizures can occur during DKA, but they are not a common or direct result of the condition itself. Instead, seizures are typically caused by complications that arise during treatment or from the metabolic disturbances associated with DKA. First, let's clarify the difference between ketosis and ketoacidosis. Ketosis is a normal metabolic state where the body burns fat for fuel, producing ketones at safe levels. This is the goal of a ketogenic diet. In contrast, ketoacidosis is a dangerous condition where ketone levels become extremely high, leading to acidosis and potential organ damage. In DKA, several factors can increase the risk of seizures. One major factor is electrolyte imbalances. Rapid changes in sodium, potassium, calcium, and phosphate levels during DKA treatment can disrupt normal brain function and lower the seizure threshold. Another factor is hypoglycemia, which is when blood sugar drops too quickly during treatment. This can lead to seizures, especially if insulin is given to correct high blood sugar without proper monitoring. Cerebral edema, or swelling of the brain, is a rare but serious complication of DKA, particularly in children. This condition can lead to seizures, coma, or other neurological symptoms. Hyperventilation is another aspect to consider. Individuals with DKA often breathe rapidly to compensate for acidosis. This can result in very low carbon dioxide levels in the blood, which may cause seizures in rare cases. Other metabolic disturbances, such as low calcium or low phosphate levels, which can occur during DKA management, may also contribute to the risk of seizures. It's important to note that seizures are more commonly linked to extremely high blood sugar in non-ketotic hyperglycemia or very low blood sugar, rather than directly with DKA. However, the metabolic chaos of DKA creates an environment where seizures can occur if complications arise. For those following a ketogenic diet, it is essential to understand that nutritional ketosis, achieved through careful carbohydrate restriction, does not lead to DKA. Nutritional ketosis is a controlled state with ketone levels for below those seen in DKA. The risk of seizures from DKA is not a concern for healthy individuals on a well-formulated ketogenic diet. DKA requires a lack of insulin, which is not the case in nutritional ketosis. If you have diabetes, especially type 1, and are considering a ketogenic diet, it is vital to work closely with your healthcare provider. Monitoring your blood sugar and ketone levels can help prevent the extreme metabolic shifts that could lead to DKA and its complications, including seizures. So, while DKA can lead to seizures under certain circumstances, this is usually due to complications rather than the condition itself. Understanding the difference between ketosis and ketoacidosis is key for anyone managing diabetes or considering significant dietary changes.